presentation. Hi, everyone, and welcome back to the MP Solution AI podcast. I'm your host, Marie Pition, and today I'm truly excited for this conversation. We have a special guest.
Hi everyone, my name is Deepthi Behel, Deepti Behel.
Nice. What's a lofty name? DBL. So,
Deepthi, or you can call me Deep.
Deepthi. Okay. It's beautiful. So, thank you so much for being here. How are you doing today?
I'm doing good and I'm excited to be a part of your podcast and share my journey with your audience and you.
Nice. I'm good, and I'm excited to get to know you and hear about what you have to share with us. Where are you calling from?
I'm calling from San Jose, California.
Okay, how's the weather there?
It's very cold out here. I'm just sitting in my bedroom and I don't want to move out of my blanket.
I'm in Orlando. It's pretty chill over here. I like the weather.
Oh, nice. How it's nice and sunny out there most of the time, and you don't need to bring your sweaters on.
Yes, 100%. So today, I would love to start with your story because your path into healthcare and data is incredible, inspiring. So can you share what first inspired you into the healthcare data and what led you into the field? What opened the door for you?
Sure. Before I get started, let me give a brief introduction about myself. I did
Mhm.
my undergrad instrumentation and control engineering from India and had worked in India with companies like HSBC and Accenture before I moved to US to do MS in business analytics and information management from Purdue. After that, I have been here working in the data field as a data engineer, data analyst, building a lot of ETL pipelines, optimizing SQL queries, building some fancy dashboards using Tableau and Power BI. But unfortunately, in April of 2024, I was diagnosed with end stage renal disease. I landed up in
I'm
ER only to
sorry.
know that I immediately need a transplant to save my life, else I would have to depend on dialysis for rest of my life. And that's how my journey with healthcare data began. And since last almost 1.5 years, I started with dialysis on April 2024, and I received my kidneys in January of 2025. The most people I have been talking are the people who belong to the healthcare sector, be it insurance companies, be it my dialysis nurse, be it my transplant doctors, be it even a dietitian or anyone from the healthcare sector, even a pharmacy, because I get my medication delivered through an online pharmacy. So I thought, I have been just talking to these people a lot. I now understand in and out of the healthcare sector and had learned to navigate with a serious health condition myself. Why don't I try to see if I can use my knowledge in the tech field with the healthcare and rebuild my career? Because unfortunately, after transplant, I had to start looking out for a new role, and this seems like a right opportunity and even the time that I can upskill myself, learn more about the things in the healthcare data sector, and see how I can combine my technical skill set and AI skills to make something better. And I started off by engaging with a lot of companies which offer AI training like deeplearning.ai and Outscale and Segment. And then I created few AI applications using vibe coding on my own and showcased them to the potential employers. And that's how I landed up my current role as a data engineer in Gift Health. It's an online pharmacy, and I work on managing the ETL pipelines as well as work on data warehouse strategy and modernization.
Wow, that's amazing. Wow. How did your personal experience shape the passion you have today to transform care delivery? Because I know you've been through a lot. How do you manage for transforming care delivery?
My journey has not been easy. I was in the mid of a work day when I was choking. I went to ER. After almost 4 hours of waiting, multiple blood work as well as ultrasound. I was just given a very hard truth by the nephrologist that my kidneys are no longer working. It took me a little while to accept the truth and start thinking, how do I manage my own health, navigate those through? And trust me, my journey has not been easy. I had come up across a lot of challenges in between, managing a job, learning how to navigate through the different government policies like VTA paratransit or a disability leave, or even simple things like scheduling multiple appointments with doctors or care team or dialysis treatment. And in fact, for almost 6 months, I used to do self-administered dialysis on my own. I was hooked from a dialysis machine. I can send you a video link that you can share with your audience later. For
Mhm.
almost 9 hours, at 9 p.m., between 9 to 10 p.m. every night, I used to set up the dialysis machine, hook my body to it, and it went on till the almost for the 9 hours. Then I had to unhook myself in the morning, begin my day, my regular work life. And unfortunately, not many people who were working with me were unaware that how my night is going to be. Sometimes the dialysis machine was beeping or some other issue. I was constantly calling Baxter Healthcare or my dialysis nurse who were on duty to help me out with the issue. But fortunately, I got kidneys on January 4th by a miracle call. So that was a good start of this year. And I still come up across a lot of challenges. Like after transplant, uh, I was in hospital continuously for 3 months from January 4th, 2025 to 12th March 2025. Then even in this June 2025, between 12th June to 18th June, I was in hospital due to
Wow.
some complication or other complications. And unfortunately, medical science do not have any answer why my kidneys failed, why what happened to my body after transplant, why my body did not accepted certain medication. They don't. And
Wow.
to be honest, this journey taught me a lot of lessons. While on dialysis, I was on a very restricted diet. So I had learned to curate my own recipes by looking through the ingredients I can rely on or browsing on the websites for kidney friendly recipes while being on dialysis or talking to multiple dietitians or friends. Okay, what can I eat? Because I cannot eat potatoes, I cannot eat tomatoes. And somebody who likes tomato soups, French fries as the comfort food, it was very challenging. But I think when you have a minimal choices, you just learn how to optimize your choices, and uh, it makes you a more better person.
Oh, wow. I'm sorry to hear that. You've been through a lot. But how did you combine your when you were taking care of yourself and still get to work with people and work your job or and keep involving to others?
So actually, during at the workplace, whenever I had the doctor's appointment due, I used to just mark my calendar. I'd let my coworkers and managers know that I'm not going to be available at this time because I have my most important priority in my life to take care of. I still do that. In fact, you won't believe that I was actually in the hospital yesterday for a minor surgery, and from the even the Wednesday, I went to lab for some essential lab work required by nephrologist, and even on Thursday, I was back to the hospital because they needed some procedures or pre-screening before the surgery due yesterday.
Wow.
I just adopted this as a daily part of my life. I just keep the my office people in loop that I'm I'm not available during this time, and as long as but whatever work I do at my workplace, do it with due diligence so that they don't actually find that as a reason that I'm using my health as an excuse to run away from work. I don't do that. I'm pretty much diligent, and whatever I promise to deliver, I deliver that on the time with proper checking. And I've started to incorporate AI in my day to day life as well, like creating a timetable for my medication because I am on anti rejection medicines, which needs to be taken at certain intervals of time. I cannot miss that. And I also need to use the AI to manage my appointments. Like I have to book my calendar, like, okay, this time I have a meeting with you, or my appointments with the doctor's team or insurance or any other things.
Wow. Thanks for sharing. Thanks for sharing. You are a strong woman. Um Now I want to shift into something that's a lot of listener are curious about, AI in healthcare. So from your perspective, what role do AI and or generative AI play in improving workflows and patient outcome? How do you see AI helping care teams reduce burnout, improving decision making, or streamline processes?
I think AI has a lot of potential to help improve the patient care experience, because a lot of data here right now lies in silos. So AI can help in bridging that gap and give more clarity to the patients, and also enable the caretakers to focus more on the giving individual attention to the patient. Like suppose I have an appointment with doctor. Usually before AI, doctors used to spend a lot of time in writing what they had in the 30-minute discussion with me.
Mm-hmm.
Like almost if you go to your aftercare summary in your My Health chart, you will see the points. Okay, how much time the doctor actually spent on talking with me, what were the action outcomes he recommended to me, and when is the next appointment due. But with the AI, we have tools that can actually transcribe the meetings and can summarize the meeting notes and enable the doctor to focus only on me, and he can just take the outcomes required and tell the other care team, okay, I have just spoken to this patient Deepthi. She's currently experiencing these symptoms. And my next action items would be that there is a need of a change of a medication, something like that. He can more focus on the strategic thing and keep me as a priority. That's one of the key use I can see with the AI coming in. And also, like, we are all there are other elements within the healthcare which we usually ignore, like the nurses or clinicians or pharmacies. They can use the AI for the prior authorizations of the prior authorizations. Like whenever I go to the hospital, AI or before even I reach the hospital, AI can already check my eligibility for a specific procedure and inform me that this is the bill which is due by me, and which is the bill component will that be taken care by insurance, so that I do not get any surprise bills. Because another critical issue I had faced during my journey was that a surprise bill of 117K that was classified as occupational injury by hospital billing department or insurance, and I have to fight with them for 2 months at stretch to get that matter resolved.
Oh,
They
wow.
started putting a blame game on each other, and I have to call them in between my work hours, which also started impacting my mental health, which is not really good because it can harm my kidney. And I'm still scared, like if something happened to my transplanted kidney, what would happen to me? Would I would be in dialysis, or would I even be alive? Those are the questions that still bother me each and every day. So this is some area which has been neglected for a while, like unexpected billing. And I think with AI, insurance companies and hospital can work together to make sure that patient do not get any surprise bill, and he is well aware of what are the outcomes required, and outcomes would be coming in. And also as a patient, where I see AI personally improving my life is that I can better manage my schedule, as well as when I get the lab results. I sometimes used to panic a lot because I go to lab almost once in a month. And when I see the changes in the different lab values of say creatine and potassium, I do not understand those numbers. AI had helped me in explaining what these lab results mean and how I can manage my health. Like how can I make required changes in my diet? How can I make a required changes in my exercise routine to make sure that these numbers are within the range? And do I need to be careful about something like a certain spike in one of these numbers can be a trigger for something serious coming up. So, and
Nice.
and this is some of the information which is not conveyed, because when I go to the lab after 24 hours, I usually get a lab report, but there's nobody who can guide me. So I just copy paste the results in the AI or chat GPT these days, and ask them to infer this result so that I know what's going around with my body.
That's great. That's pretty impressive the way you're implementing AI on your day-to-day basis. So, what one thing you will tell someone who is very, or my guess, who are very like kind of like new to AI, they don't know how to use it, or they kind of skeptical about using AI? What one thing will you like to tell them?
See, when it comes to actually adopting AI or any new technologies, there is always a resistance coming from the normal people. To be honest, when we got the even a new model of phone is coming up, even we are scared how to try it. So that is actually relevant with the AI. the one of the key concerns the people had raised to me personally is that, is it too difficult to use? Will it leak my personal data? These are some of the scares I have to tell. I have actually listened to, because I'm a part of a Kidney Stories Toastmaster Club, and I talk to kidney patients almost every day. Most of the people I interact frequently are a kidney patient or someone to do with the healthcare sector. So I tell them, if you go to the chat GPT or any other AI tool, there's an option where you can check the on the privacy setting not to leak your data, and also not to use it for the further training, because sometimes the people even enter their personal information, which makes it very easy for somebody to hack into your system, hack into your personal information like your banking information or other information. And HIPAA currently do not allow the patient information to be leaked publicly. Like, I work as a data engineer in a healthcare company, so I understand these things very well. I'm not supposed to expose the patient personal information like his date of birth, his SSN information, or name, or even address on the public platforms like ChatGPT.
Nice. So I know you have a job, right? You do have a job, or you do have your own business.
I have a full-time job. I work as a senior data engineer at gifthealth.com. It's a specialized pharmacy. So they partner with the Eli Lilly and deliver Zepbound GLP-1 drugs to the Lilly patients.
So how do you think AI can make this your work more effective, or what one thing you would love to implement, or AI tools you would like to implement in your workflow?
So I work a lot on the technical sector. So the way I have been using AI and would recommend anyone you are working in the technical sector is first to better plan the things, help in the prioritization. So in that matter, the AI has really helped me. I usually use Claude or combination of ChatGPT or Notion AI Tracker or Linear for that purposes to prioritize the works. Like every week I get certain tickets assigned to me, and then I can sync up with the AI, like depending on the things I hear from the stakeholders, like by when they need it, what is the critical importance or strategic business importance, help me in prioritizing, and also give me the exact timeline I can deliver that. I don't want something like, okay, I can deliver in 8 hours and then it took 12 hours as a surprise.
So
So then that's the first thing. AI had really helped me in prioritizing my work. And second, on using the proper communication, because most of the technical people struggle to explain the challenges that they encounter, that had maybe giving taking to why they like, suppose I've been given a question, why did the task too long to cover, and technical people are not really able to answer this question well, because they were busy debugging the code or checking the data for the reliability. In that manner, I can just use the Gemini or a chat GPT or a Claude and give and put in my thoughts, why I, where my how I was doing the work and where I got stuck. So AI can really help me in creating a good communicative structure or speech. I can tell to my stakeholders that why I this work took too long. This is the very good application of the AI I personally use, because this is the thing any technical person actually suffer from. They don't know how to explain their work to people, or why they're taking too long. So that's one of the biggest advantage AI is bringing in. And third is in the vibe coding space, because I personally use AI. With AI, even building a small data pipeline or making a small change in the application and its debugging has become so easier. What used to took me like 4 hours without AI is now hardly taking in 1 hour. I can focus on more tasks and focus more on learning new skills that are coming up in the market and stay up to date.
thanks for sharing. But also, how have you built any workflow? Are you familiar with workflows like NEN, or so how do you just use the software separately?
I'm aware with the N8N workflow, so I have not built any work. I did build some workflows, like I have set up some AWS Lambda jobs. So I've created a workflow that checks the result of the ETL pipeline, which is executed by Lambda, and share its result with me and let me know that if there are any issues with the pipeline, how many records were inserted, or basic quality checks on the pipeline. So this really made my job a little bit easier to work on. And also, if you go to the GitHub, so GitHub has certain action bot, and you can also link cursor bot or Claude to do a peer review, which is more effective and efficient than a human review, because it checks the code so thoroughly, which even engineers tend to miss out.
Okay, nice. So for myself, I use workflow or company. We build workflow for people. Like we connect all the system together, like Gmail, a Slack account, and anything is automated. We kind of like build those workflow for people. So I just
So,
wanted to ask if you're familiar with those workflow.
So we actually have enabled a Slack notification workflow for many of our ETL jobs, because usually the business people check those Slack alerts to see how the data is looking in, how many records are being there, without exposing the PII information. That's the critical thing. Like, you can even create the workflow automations inside the BI tools like Tableau or Domo or Metabase. Similar to what I have done for the AWS, as well as even inside the Looker, there is a possibility to create alerts, or in the GitHub. As for the GitHub, we have enabled email notifications.
Oh, wow, sounds good. Thanks for sharing. And I'm very impressed by all your knowledge and how you navigate with your health situation and still, working on day-to-day basis to help others. But so would you mind to reconnect next time, or are you available to reconnect next time?
Absolutely. And in fact, I forgot to add one thing when you were mentioning the how I use AI in my workplace. So there's another two tools which I use frequently, that are Gamma.ai, because you can even create your own presentations and website with Gamma.ai, as well as Napkin.ai. I have found both of these tools very effective and efficient for delivering presentations to the larger audience.
Yes, I'm so familiar with Gamma. Gamma is a very good tool because I use Gamma every day because I do have client every day and I always have presentation. It's so easy to kind of copy paste my presentation and it will generate AI pictures, image. So it's very cool. So that's great.
You should also check napkin.ai as well. That is has a very different case, different usage compared to Gamma. And I also find it very useful in actually delivering couple of presentations, because recently I was invited as a speaker for a few of the conferences, and I relied purely on napkin.ai and gamma.ai to build my presentations, and it took like 1 to 2 hours using both of them and chat GPT prompts.
Sounds good. Sounds good. Thanks for sharing. I'm actually, I think my guests are taking notes. Um, I know I do have another podcast schedule in the next 5 minutes, but thank you so much, Bahel, for joining us, and I hope to see you soon.
Thank you, Mary, for including me, and wish you a Merry Christmas in advance and Happy New Year. Hope to connect soon.
Yeah, same to you. Thank you. Thank you. I was excited to meet you today.
Yeah. Bye bye.
Bye.